This segment is sponsored by Virginia Urology.
The doctor is in and you have questions. Today, I'm joined by Dr. Rebecka Meekins. She's a urogynecologist with Virginia Urology. Good morning, Dr. Meekins. It's wonderful to see you.
Good morning. How are you?
I am well. Thank you for asking. I'm delighted to spend some time with you. I understand you are new to Richmond. What brings you here to the area? Where were you before?
Yeah, so my husband and I were in Durham, North Carolina before. That's where we completed our medical training. We were at Duke University for medical school, residency, and our fellowships. And then we moved up to Richmond to start our jobs.
Well, fantastic. We're delighted to have you here in the Richmond area. And I have a question for you. Why does someone pursue urogynecology? This is something I'm sure that you work with a lot of new mothers in this area of specialty.
Yes. So urogynecology is a very unique field within OBGYN, and our primary focus is treating women with pelvic floor disorders. And that could include things like pelvic organ prolapse, urinary incontinence, as well as recurrent urinary tract infections and sexual dysfunction. There are so many different parts of what we do. But you can imagine those things can be very problematic for new moms. So although we see women, the whole age range, we definitely do see women in the postpartum state also.
Dr. Meekins, is this area of specialty as a urogynecologist compared to a gynecologist, is this someone that you choose to see when you have these issues, or does any patient come in to see a urogynecologist?
So we don't do things like sort of annual exams that we'd want every woman to keep up with and see their gynecologist regularly. We really see people who are having issues with pelvic floor disorders, as I mentioned. So women who are struggling with prolapse or urinary incontinence, those are the patients that typically come to see us. And, as a urogynecologist, you get some additional training through our fellowship on how to treat those disorders. And we have very specialized therapies, everything from, very conservative measures all the way up to surgery that we can do.
Dr. Meekins, you mentioned a series of conditions typically that would bring a patient in to see you. Who is impacted by these conditions? Is this a certain age range, or can this happen across a spectrum of ages?
It really can happen over a spectrum of ages. The vast majority of women that we see are postmenopausal. So typically older women are most affected by especially prolapse and incontinence. But those conditions can affect younger women too. And we really do see women of all ages in our clinic. Additionally, as I mentioned, we do take care of women with recurrent urinary tract infections. And this is a condition that certainly can affect younger women also.
It makes sense. And definitely when you're hearing these things, for folks listening today, this may be impacting you. We see ads on television. We know that urinary incontinence is pretty common. It's just not typically common to be talking about it, right? We're not having these conversations. A lot of women maybe accept this as a new normal for them, especially moms, but it doesn't have to be.
That is exactly right. I often tell people, when they ask me what I do, that Urogyne isn't something that people talk about at the dinner table with their families or when they're out to lunch with their friends. But, having urinary incontinence or prolapse or any of the conditions I've mentioned is not something that has to be normal. It's not normal. And there are many treatments for this. So, especially new moms who might think, oh gosh, this is how I'll be for the rest of my life. You don't have to. We can help you. And there are many therapies for the conditions that we treat.
Let's dive into that a little more deeply. As you say, it doesn't have to be the normal, but I think when you do start having this conversation, you find out it's impacting quite a few of your friends and family that you may not have realized. What can you do? How are these conditions typically treated?
Yeah, so we can talk about urinary incontinence. This is such a common condition for women across the spectrum, including new moms. And this can be treated with everything from pelvic floor exercises that we can instruct women to do in the clinic, and they can take that home with them, to pelvic floor physical therapy with trained women physical therapists who can help them work on their muscle strength, as well as surgical interventions like midurethral slings that as urogynecologists we are trained to place. And, so there really is a broad spectrum of intervention depending on how bothered someone is by their condition.
So if you're experiencing these conditions, you might want to pursue seeing a urogynecologist. Talk about the options. And then where are you seeing patients?
So currently I see patients at 3 offices. We have a Stony Point location, as well as our location at Reynolds Crossing in the West End, as well as our Hanover office up in Mechanicsville. So 3 different places for patients to come in and be evaluated and treated.
Well, Dr. Rebecka Meekins, we are delighted to have you in Richmond at Virginia Urology. We're going to share some information so folks know how to get in touch. Thank you.
Thank you so much for having me.
Our pleasure. Virginia Urology's office and surgery center is at 9101 Stony Point Drive. You can learn more at uro.com for a full list of those office locations, or give them a call, 804-330-9105. Stay with us. There's more Virginia This Morning after this.